you've had a real focus on mental health for specific vulnerable populations and crisis response. Can you talk about those efforts, why you engage those efforts, what you're doing, and what kind of impact you're seeing on the ground?
Yeah, well, and certainly, we saw that our country was really dealing with a mental health crisis post-pandemic or during the pandemic. And now we've come out of that and we're sort of dealing with a mental health crisis in so many other ways, right? We're just when people's livelihood is really being threatened right now. I probably started on the mental health journey many years ago, before I even realized that I was fighting for mental health policy. My mother is a psychiatric social worker. I grew up in that environment where mental health care was always very important. I've talked about my own struggles with depression and anxiety over the years very openly, in the hopes of reducing stigma around discussions with respect to mental health care. I've been a huge proponent of mental health parity, treating illnesses of the mind just as we do illnesses of the body with respect to insurance and care. Availability of care. And so it seemed very natural to me coming into the state legislature to continue on this journey and fight for mental health care in so many aspects. But something that really spurred my interest was a friend of mine, a local producer, actually produced a documentary called Ernie and Joe Crisis Cops, and it followed two crisis intervention officers in San Antonio, Texas. They have their own crisis intervention team, and it's something that they take very seriously. And the film inspired me. I started digging in Connecticut to find out how many law enforcement officers were trained in crisis intervention, recognizing that so many of the calls that they have are in fact related to mental health and crisis. And I found out that, well, we did have a program. There were many police forces in my district alone that really had no officers trained in crisis intervention. And I'm proud to say that over the past 6 years, that's changed dramatically. We've been able to secure funding for crisis intervention training. We've been able to move that forward. And now we see so many forces. Most forces across the state of Connecticut have at least one officer trained. Many have all of their officers trained in crisis intervention. And now we're seeing more and more funding for police social workers and things of that nature. This past session, I introduced a bill to address mental health care in our corrections department, in our prison system, because I do feel that that is lacking right now, and it's something that we can certainly improve upon. And so I hope that we'll see forward movement with that as well.